Purple Line is a community podcast bringing you in-depth conversations with diverse leaders in the public and private sectors. Whether you're a student looking to gather advice or a professional tuning in for valuable resources, our dynamic programming provides inspiration and insights for all ages and backgrounds. I'm Marianne Gomez-Horta, your host of the Purple Line podcast and the CEO of the Congressional Hispanic Leadership Institute. Welcome. Hi, Paule. Thank you so much for joining us on the Chili Purple Line podcast.
Thank you so much for having me. We've been trying to make this happen for a little while, so I'm excited to be here.
Full disclosure for the whole audience, we had an opportunity to get to know each other. Can you believe this? This time last year, we were graduating from the Presidential Leadership Scholars Program. Isn't that crazy?
Time flies,
it does.
I was just reflecting on that time and how grateful I am to meet, 56 diverse individuals in terms of all areas.
Right. One of the things about these opportunities to have these conversations is to really sit down and have a conversation with diverse leaders from different backgrounds, different places. Our audience are interns, young professionals, and also some very seasoned professionals, mainly in Washington, D.C., but across the country, as you know, that we reach many. So we want to do a little deeper dive into your story, your journey, and have some lessons learned from some of your lessons and experiences as well. So I want to take you back to growing up in Venezuela. So share with us where you grew up in Venezuela and why was your family in Venezuela in the first place? To kind of share and start with that. So if you could.
No, that's always a great place to start. So, I was born and raised in Venezuela, but in an area called Guatire, which is like about 30 minutes outside Caracas.
Okay.
So Guatire, Guarenas, and that's where I was born. I was raised. However, my parents are from Haiti.
Oh, okay.
So,
what was the environment like that you grew up in? Was it more like a big city or was it more rural? What was that like?
It was like intermediate.
Okay,
It was like,
a little mixed.
It's like it was mixed.
Mm-hmm.
So my dad fell in love with Venezuela as he was learning about Venezuela as he was studying.
Oh, interesting.
So he knew that when he was going to graduate school, he was going to move to Venezuela, and that's what he did. He went to Venezuela, started his business in Venezuela, and then went back home to pick up my mom and got married.
I love it.
The next day or so, takes my mom to Venezuela.
Wow.
And the rest of history. My sister and I were born in Venezuela.
Do you have any other family from Haiti that also did the move and followed your dad?
Actually, no. My dad did it first. And
wow.
Then others came.
Yeah,
so, like growing up in what I call this duality of culture,
very
right?
Much.
My dad already knew he loved Venezuela, so he was very adapted. But, my mom had to, adapt to things. So I grew up eating arepas and eating black rice, right?
Wow.
It was just like
that
mixture of culture and mixture of flavors. So by growing up in such a diverse community as well. I mean, we had people from Spain, people from Portugal, people from different places of the world. I mean, I felt like I was living in a mini United Nations.
That's pretty cool.
So it was really, really cool. So I went to Catholic school. Because that's
what you do. Yeah, that's what you did. Exactly.
And then you have to learn the perfect handwriting, right?
Yes.
So went to Catholic school my whole entire life from, kindergarten all the way out to high school. But our educational system is pretty much like the European system. So by the time I was 16, 17, we had finished.
Oh, I know. That kind of drives me crazy about the system here. We're always a little behind, I think, in some of the other, right? Because you also probably learned English at a young age, right, in Venezuela.
Yes.
What grade were you when you started to learn English?
I think we were like 4th, 5th grade.
Yeah.
We were learning English, so like you always have to learn a second language.
Right.
So at home, my parents speak French and Haitian Creole and Spanish. So you learn all those languages.
Right.
And plus at school, you're also learning English. And it was just primarily like learning how to write in English, how to think in English. And, you know, when my dad moves to Venezuela, like he became an entrepreneur, but he was a professor. So I grew up every weekend. He would wake us up early in the morning to study math and English.
Oh my goodness.
Yeah. So I think our neighbors
Yeah.
knew, like they will hear him yell and scream the math tables, and like, you know, we have to recite the tables
my
and all
gosh,
of
that's
different
hardcore.
things.
Oh my gosh.
He's very hardcore.
I love that.
But,
Oh my
but
gosh.
you know, later on when I moved here and I was going to school, I said, oh, I already know these concepts, right? It was just very easy, and he also gave me like a love for math and science.
For learning.
And learning.
And you're also a good teacher as well, so I think you probably got that a little bit from your dad,
Probably.
too. Yeah,
He'll be
just a
so
tad.
proud listening to this.
So you finished high school over there, and then you moved.
Yes.
And why did you decide to come to the United States?
Well, I would say...
Was it that you decided, or did your dad say, "Sabes qué, mija? You're gonna go"? How did that come about?
Sabes que, mija?
Yeah, exactly.
That's the actual.
Yeah, exactly.
So I think you kind of figured like my dad already.
Yeah, I think so.
So you know, it was 2000. So I moved here in 2000, and you know, it was right around 1998. It was just around when, you know, Chávez had won the election. Now my parents grew up during the Duvalier regime in Haiti, so they had that experience.
They knew.
They had that experience. And I remember I was young, but I remember one of the things that my dad mentioned, and he said, you know, this is going to become like Cuba and Haiti, right? I don't know. I mean, I didn't ask a lot of questions then, and you know, that was the first time I saw my parents argue, ever, because my mom was totally against me moving here by myself.
Okay.
It's like, how are we gonna send her there by herself? What's gonna happen to her? My dad was like, nope, she's gonna leave and she's gonna go. So that was the thing.
Wow.
So I first went to school in Miami.
Okay.
To learn English, because we needed to make sure like I was embedded into a school that I could learn more English. And eventually I moved to Jersey in New York City.
And so moving on to college, I think you were at the University of Pennsylvania, is that?
That was for my Ph.D.
Okay, that was for your you got an associate's degree first, right? Yes. So where was that?
So I went to Hostos Community College in the Bronx.
Okay.
So my uncle, who I would meet, he would say, I think you should go to Hostos because, they speak English, but they speak Spanish there in the community. And I think it was his way of saying, you need community.
Right.
And community is important, and you need to be somewhere where you're going to feel welcome, so you can thrive.
And you can thrive, right?
Yeah, so we can thrive. So I ended up going to school in the Bronx, which was
I was going to say, how was that? Did you feel like you were part of the community? Did you feel like you belong?
Yeah.
Because there's always like, I'm going to go, and then you get there and you're like, oh my gosh, I don't know what I'm doing. Sometimes it's a little hard still to find your community.
So so my first day in school, I remember being at the registrar's office, and everybody assumed that I only spoke English. Mm-hmm. They didn't necessarily, they saw a dark-skinned girl.
Right.
Why would she speak Spanish? Was probably the question. So I still remember that till this day. And then, they were having an interesting conversation at the time, and then I responded back in Spanish, and I think everyone turned the color of your card pale.
Yeah. Yeah.
So it was interesting, and that's something I still get till this day.
Yeah.
But I mean, I think it's normal. I mean, probably unexpected sometimes. Yeah. But it was great because eventually I would find that community. I think one of the things that I liked about Hostos is that he had, a lot of individuals from different areas, but a lot of Dominicans, a lot of Puerto Ricans. I mean, the school is created by someone from Puerto Rico.
Yeah.
So he had a very robust Hispanic community. Mm-hmm. And, I was in the nursing program. The nursing program demographics looked a little bit different than the rest of the school. But
Interesting.
it really taught me a lot about, you know, why a community college was so important. For me, I see that experience in the community college as a stepping stone to that opened my mind to things that I didn't necessarily know I needed at the
Right.
time.
That's a good point. And to your observation earlier, right, that your uncle felt like this might be the place to start, right, versus going straight maybe to a 4-year university, and so there's a lot of dynamics in it. One, it's probably more expensive, or it's a little difficult to get in, or it's further away, and how you're going to get there. Are you going to live on campus? There's a lot of things that I think that, at least for some of us who are the first ones to go to college, or you have to experience that. They don't know what they don't know, but they know they want to try to figure out how to keep you safe. Exactly. And at the still time, like your dad, still try to push you a little to go do something else, right?
And we couldn't really afford it at the time. If remember, like I moved here in 2000. It was the beginning of the Chávez era, and there was an embargo. There was but so much money you can bring out of the country, except if it was education. So my parents had to figure out how to pay for school for me from Venezuela and here. So going to a community college was the right first step for me. Yeah. Because there was something that, that they could afford and that I could supplement by working in school. I think I became an intern for every professor that I could become an intern for, and having those opportunities really also created exposure to things like, student government, and why even getting involved in student government was important. That civic duty, even within the school.
So did you run for a position in the student body?
I ran for a position student body at every school that I was in.
So did you serve in the student government there?
I served in student government. I'm even thinking about what I was doing. I think I was probably one of those peer network type of individuals. And then when I went to Penn, I also ran for student government at the grad school.
Okay.
But I was the director of international programs.
Okay, because that makes sense.
Because it was for international students. Right. So remember, when I came here, I was on a student visa. So I was an F1 student.
Right.
And then, later on, because I went to school for nursing, I was able to get my green card sponsored, because there's a shortage of nurses.
There is.
Till this day.
There has been for years, for decades, probably.
For decades.
Yeah.
And so that was, that was sort of my entry into, sort of like, education.
Right.
But also becoming a professional here, in the United States. And, I would have not done it any other way, because my mom is a nurse. I didn't tell you.
No. So you kind of did the segue for me, because I was going to ask you, why did you pick nursing? So did you pick nursing because your mom was a nurse and you were exposed to that a little bit, or did you think, this might be that kind of career that I could almost do anywhere? There's people that kind of think along those lines too. So why nursing?
I think both. Okay. I grew up seeing my mother be the nurse in the community. At first, I didn't want to be my mom or my dad, but I became my mom and my dad.
And your dad, yes.
Right? When you're young, you're trying to be a rebel. So I'm like, no, I'm not doing that. But there's something that, that gets into your soul, right? And the idea, like for me, service. I think one of the things that was very ingrained in me growing up was
by both your parents.
By both of my parents has been the importance of service. I mean, I look, of course, whether it was nursing or even me as a scientist now, I always think that that's a way of serving the community.
Oh, definitely.
Yeah. And so I wanted to become a nurse, one, because I saw the impact that my mom will have in our immediate community. I also saw it as, considering my own personality, that I like to do different things. I think you got to know me. I like to do different things. I saw it as one of those professions that, whether I am in the U.S. or I am in Antarctica, or I am in Europe, or in Asia, in Africa, I can be a nurse,
Right.
and I can serve people,
And you can serve
I
people and help, yes.
I can do this work, and I love the flexibility. I like the flexibility that you can, work in the emergency room, or you can work in the ICU, and
in the community, in the private sector,
I love
you
it.
have all of that experience.
So I think we need more nurses, and I love the idea that I could also be a scientist. Mm-hmm. And that was extremely important to me.
So take us from that aspect of it. So nursing, I don't always honestly think of nursing as a scientist. But in your role now, you very much are a scientist. And before you share a little bit, so I need to go through this list because I think you are one of the few guests that we've had that's had a lot of credentials. And so I want to make sure that I honor that. So after you had your associate's degree, you went on to earn your bachelor's at Penn.
No, my bachelor's at the College of New Rochelle.
Ah, okay.
I still stayed in New York. I'm a New Yorker through and through, okay. If you're going to tell me.
All right. And then you went to get your CRNP, which is the Certified Registered Nurse Practitioner, yes, right? Where did you get that?
I did that at Pace University. So right close to the World Trade Center. I always tell people it's like that. That was Pace University. They had 2 campuses.
Okay.
Yeah, so after I finished my bachelor's degree, I went on to do my master's as a nurse practitioner. But there was an important thought process that happened. When I finished my associate degree, I knew that was not the end. I knew that in order for me to have impact and to do the work that I wanted to do, I needed to continue my education. So I graduated with my associate degree, and I registered right away to do an RN to BSN program, so I can get my bachelor's degree.
Okay.
And because I was already a registered nurse, the hospital I was working with actually paid for my education.
Wow.
Yeah, so those are perks.
Exactly. You don't even realize, yeah.
So they paid for that, and then they also paid for my master's degree.
Okay, because so then you did the Ph.D. after that.
Yes. So while I was at Pace University, I met faculty. I think this is the importance of students getting involved.
Okay.
And having conversations with their professors and their teachers. Not like
that's a good lesson.
Yeah, it's not like just going to school, but being embedded in the school, being active in the school.
I didn't learn that until probably my second, third year as well in my undergraduate. I kind of was afraid of professors. I was kind of like these are the really important people, and I have to show up and do well in school. The first one in my family to go to college. My parents only finished 3rd grade, so they didn't even know what high school was, right? So I remember just thinking, wow, I'm here, but these are like really important people. And it wasn't until my sophomore year that I had a professor who kind of made it a little more like less scary. Right? So she had office hours. I mean, they all did. But for some reason, she just kind of seemed like the one that I navigate. And to this day, I'm still friends with that professor.
Isn't that amazing?
Yeah, I love that.
And I still remember it was, Dr. Jaffe Ruiz. They were, and the dean at the time, they were doing an encyclopedia for nursing.
Oh, interesting.
Right? And they needed someone to do research and to do searches and help with the writing and the editing. I mean, at the time I was working full-time too, but I said yes. And I think this is the importance and the power of yes. Sometimes you say yes and you might not know where that yes is going to take you.
That's a good one, yes.
And I said yes. And, I became an author on several of the entries for that encyclopedia. And it was one of the first contributions academically that I did.
Oh, nice.
And, as I got engaged with the faculty, I think they saw something in me that I probably didn't see in myself. We often say that. But, they were like, have you thought about a Ph.D.? I thought I was going to do a Ph.D. in history. And
in history, different than nursing. That's different than nursing.
No, but I thought I was going to do a Ph.D. in nursing history.
Oh, in nursing history.
Because while I was in New York, I went to the Settlement Museum.
Okay.
right? And I got to learn a lot about yellow fever, different immigrant communities that were coming into New
Yes.
York and the importance and the health repercussions of it. And I was so excited about it. And then I went and did a PhD in genomics, okay, and genetics.
And where's your PhD from?
The University of Pennsylvania.
Oh, Pennsylvania.
Yeah, so
okay.
I went and did my PhD at the University of Pennsylvania. And after I finished my PhD at the University of Pennsylvania, I came to the NIH to do a postdoc. So when you finish your
okay.
PhD, many people, like one of the advice is that you do a postdoc where you can gain additional skills that you have not traditionally gotten during
A little
your
more of
PhD.
the hands-on experience.
Yeah, more extra. So
Right.
you do your 5 years and then you do an additional 5 years or 3 to 5 years. But I was in this accelerated track when I came to the NIH. So after I finished my postdoc, I got an opportunity to stay as an assistant clinical investigator, which is similar to like an assistant professor position at a university. And then later on, I applied for the Lasker Clinical Scholar Award, so like the Lasker Awards.
Right.
And that gave me the opportunity of then opening my lab and becoming part of the tenure track. So many
okay.
people don't know that
Yeah,
NIH
that's very
has
intense,
a tenure
too.
track.
Yeah.
Tenure track positions. And then I just got tenure last year, if you
Oh,
remember.
that's right. That's right. We were with the program.
Yeah, so
that's
I
right.
got tenure last year, and you get more resources to do
Okay.
research, which is good. But it was again like the importance as students, and especially because I have a lot of fellows and individuals that I mentor, it's like finding opportunities. There was an opportunity that I saw that was available at the NIH back in 2012. And that was an internship. It was an internship in genomics. So
Interesting.
I requested to attend, and there I learned that, wait a second, NIH is not just about giving you grants.
It's massive.
It's
Yeah,
massive.
it's
There's this
huge.
whole enterprise inside
Right.
the NIH with summer interns. I became a summer intern twice.
Oh, okay.
So
Right.
for 2 years, I
Yeah,
came
you
to
meet
DC.
people from there's people all over the world
Yes.
working at NIH.
Yeah, and it was amazing. So that was my first entry to NIH. So I said something in my mind. I said, if I ever come here, this is what I want to do. And eventually, later on, I met a faculty member at a conference. This is the importance, especially for the students listening to this. You go to conferences, don't just talk to your friends. Meet people.
Oh, yes. I always
Talk
tell
to them.
students that.
Right, talk to the person in the elevator. That elevator speech that they tell you to practice, it's important.
Yeah.
And that's what happened. I met this woman, Dr. Wendy Henderson, on an elevator, and she asked me what I did.
Wow.
And I told her in my 1 second elevator speech
Get it in,
what I
in,
did.
yeah.
And she said, you should consider doing a summer internship with me. And
Wow.
that same person would later become my postdoc advisor.
Oh,
So I
okay.
would come back and work for her
Right.
for a number of years. And look at me now. Now I have my lab and my research.
Yeah. So one of the things that was also interesting, just kind of talking, through the Presidential Leadership Scholars Program, what have you, is that you also found like a really specific interest and niche. And kind of fascinated about that too, because you don't run into a lot of people who have like this specialty in smell and taste. And I remember asking him, like, oh my God, you must have been like the superstar and super important during COVID, right? I'm sure people asked you all kinds of questions. You were probably involved in some research. Share with the audience a little bit, what made you decide to go into that kind of specialty, and what are you doing with that now?
Yeah, so, working as a nurse, I was working with individuals that had weight loss surgery. Now we don't do weight loss surgery that much, bariatric surgeries. Now we have a lot of people on Ozempic.
Whatever the other.
We have a little bit of.
Times have changed.
Yeah, things have changed. But one of my observations clinically were that, several of the patients will often say that food didn't taste the same after surgery. And, and there was another observation after the surgery, like their sugar got better. And I was very curious as to why that was. And so I actually went to Penn with the idea that I would study obesity.
Interesting. Okay.
But I said, what is the one thing that connects us all. It's food.
Right.
You know, whether we are going to a wedding, whether we're at a hospital, no matter what, any event. Tell me about an event that doesn't have food embedded in it.
Right.
And we like things that taste good, that's delicious. And I wanted to really understand why these individuals were telling me this. Right? And so I became interested in really understanding how the impact on obesity on the chemical senses, on the senses of taste and smell.
Interesting, yeah.
So I study, how obesity impacted the senses in kids that had central adiposity primarily.
Interesting.
So
okay.
that were gaining a lot more weight.
Right.
And so later on, I just continued doing that. And I had told myself, if I were to open my lab, I want to really study, how smell and taste are impacted by diseases, and what is the importance of these senses for our health and our well-being and longevity.
And this is before COVID.
Way before COVID.
Right.
So I always say that I was doing this before it was Vogue. Then it became Vogue.
Yeah.
Right.
Oh my
and
goodness.
so COVID happened, and then we started seeing comments
Right.
on social media, right? Because you probably lost your sense of smell a little bit if you got a cold. Right?
Exactly.
You probably
Right.
did that. Most people who
Most
are
people
listening
do,
to this,
and you kind of figure you are.
yeah,
Right.
So most people that are
Like
listening
maybe if
to
you're
this
congested,
right now,
you can't hear the same way, and
Yeah.
things like that. Yeah.
But it come back. When COVID, it was like the number of people that were reporting this was massive. Mm-hmm. And we're talking about March 2020.
Right.
So a couple of us were, I'm very active on social media. So for all of those listening, so
Yeah.
I started seeing comments on social media, and people were saying, I'm losing my sense of taste and smell. So a couple of us kind of got together and said, what is going on? Mm-hmm. So we co-founded the Global Consortium for Chemosensory Research. This was the consortium that was founded in a speed of light.
Wow.
So we were talking about March 13. Mm-hmm. By mid-April, we had our first manuscript published. We had a whole entire enterprise.
How many people were involved in this consortium to start with?
Okay, I can tell you we have about 764 individuals that are members now.
Okay.
We're talking about maybe 500, 400.
Yeah.
Like we recruited people from all over the world.
That's
so
amazing.
this was like.
Well, there was also a sense of urgency, right? There was a sense of urgency. We need to come together, and how beautiful that everybody did get involved, because it was another greater for the good of the communities.
It was one of those things that it takes me back, and you probably won't have to remind me of who said this quote, but it doesn't matter who gets the credit, right? Like if once we're working towards the same goal in the community. So there were so many silver linings and lessons here, especially, how to create a consortium that has 76 countries.
Right.
Right? And you have people in all different time zones, but we all working towards the same goal of finding answers to this question.
That's
the
awesome.
consortium, has evolved past COVID
Of
now.
course,
But it was...
And, you also talk about cultural competency, right? And those are the things that most of the time doctors or in medical school are not taught.
And the same thing happens to the senses, right?
Right.
Like we get one chapter probably in training, whether you're a nurse, you're physician, a PA. There's one chapter, and after that, we're not even asking, have your cooking changed?
Right.
Does food taste the same
Right.
to you?
Yeah.
Have you noticed any changes on your taste and smell? So I know, where I said advocacy is not something we do, but I've been pushing and trying to get people to say, at least empower people to tell their clinicians if they have noticed any of these questions, but also empower clinicians to ask these questions of their patients.
Right. That's part of it too, because a
We
lot
need
of
that.
times, and culturally, right? I grew up in a very traditional Mexican family that we don't ask the doctors stuff, right? We wait for the doctors to tell us, or they're going to ask us. They're the people of authority. We're not going to challenge that.
Yeah.
of course, as you know, I'm not exactly following authority all the time. And so, I would say like, wait a minute, that doesn't make sense, right? And I'd show up with a piece of paper and write things down.
But that's important, right? Because we need to be empowered about our own health. It's our body, our health. We need to be able to ask questions. And I think that that's one of the things that I loved about nursing was advocating for patients, but helping the patients advocate for themselves.
Yeah.
And that is, I think, is a critical thing that happens when in nursing. So I said I'm taking this to the federal level, whatever level I can. So I partner with the National League for Nursing, where we created a vision statement and as well as a toolkit to train nurses at all levels.
Oh, awesome.
On how to do assessments about smell and taste. Because if we can ask those questions every year when you do your physical, and then we start noticing, okay, maybe last year you were normal, but over the last
you never know.
The last 2 times we did this, there's a change. We can interrogate that change a little bit more.
Right. And figure out what else is going on.
And that's part of one of the things. And that was actually my presidential leadership program project, my PLP.
Oh, that's right.
Right? Was like, how do we create that? So that project became the work that I did with the National League of Nursing, which launched in April of this year. So it's going to have they cover about 1,700 schools around the country and some outside the country. So
they'll incorporate that into the lessons.
Talk about impact.
That's awesome. Wow, congratulations.
That's
really cool. Yeah. I've got two kind of last questions for you. Yeah. One is, what was your favorite class in college and why?
Okay. Don't have to pick one.
Well, okay, you can have 2, I guess. But okay, what were the 2?
So I know it's gonna sound very nerdy, but I love research methods.
Okay.
And I loved, statistical.
Yes, that is very nerdy, Paule. Yes. That is not usually what people say.
But it was just so fun. It was so fun to learn like the power of numbers and how we can tell stories through numbers.
Ah, okay.
And I just love that. And I also loved the research methods. I felt like, okay, this is the most powerful framework that we can, ask things and then,
there's a story in that. There's a story. Yes.
But also, I know you told me 2, but the third one was, while I was in the community college, it was my communication class, like my, you take a communications class and public speaking class. I didn't know then it was going to be that important. But it was really one of the ones that actually was challenging for me because English was like, at this point, my 3rd language? So it was hard. And I didn't necessarily get an A.
But you learned a lot in the class. But
I learned so much in the class because it was challenging. And it really pushed me to think about, what I was saying, to be thoughtful about it. And this is one of the things that even as a mentor now, I tell a lot of my mentees, seek opportunities. Don't pick these easy classes. Pick the classes that are going to be challenging. And it's okay because, the grades, no one else is going to look at your grades after a while.
After a certain time, that's true.
But
that's
the
true.
lessons are for a lifetime and they stay with you. So those were like my favorite classes.
Those are your favorites. And then, as you know, with Chile, the organization, we really focus on diversity of thought and having those different perspectives. And so, when I share diversity of thought with you, what does that mean to you? What does that say?
I think for me, when I think about diversity of thought is, bringing different experiences sometimes within a room, like the importance of lived experience, right? Like it's
exactly
the lived experience that an individual has cannot be minimized. And we need to account that into, why maybe you think the way you think, right?
Correct.
It's not necessarily just the education that you have, but your upbringing and how enriching that is, because it gives me also a different perspective. I might have not thought about, I don't know, maybe my own topic about smell and taste in that component. So I was just in Oaxaca, Mexico, doing exactly that
Yeah.
little documentary.
Yeah. Yeah.
But, and I was talking to an engineer, like an agronomist, right? And as I was thinking, I was like, wait, we're studying pretty much the same thing, but from his perspective, right? Like how he tells that, cacao or cocoa is ready, right? Like how the
stories.
smell changes for him, and how probably I'm looking at it from a lab, but that lived experience that he has, it's enriching.
Yes, it's very valuable.
So
it's
I think
always
we need,
important to bring that.
I think that, as we engage in dialogue, I think one of the things that I think is extremely important that we do is that we listen and with respect and grace, and we, be curious about learning about the other person, right? Not being in a rush. And I think this is one of the things that we learned at, at the Presidential Leadership Scholars Program, of listening, the importance of listening and dialogue, and that it's okay to disagree, but to be respectful about it.
Be respectful.
One of the things I want to say before we end that was extremely special, I told you I came here in 2000. So 2001 was 9/11. I was in New York City going to school. So my first president was George W. Bush. And I remember watching President Bush on the TV. I remember all of the scenes.
Oh, yes.
And last year, when we were sitting in that room, when President Bush in front of us, it was just like full circle. I said, I would have not thought, if you had asked that girl 25 years ago that she would meet
presidents.
One president, not one, but
we met two
presidents and a secretary.
Yes.
I was and many other secretaries, I would have said no. But I think this is what makes this country so beautiful. Like these opportunities that I don't think I would have had if I was still, home. I don't know where my life would have been if my dad didn't say go.
Yeah, and it's hard to say, when people say, well, is there something you regret? Is there something you could have, would have, should have done? It doesn't really make sense to go down that path, because I think the other path is better, right? To figure out what may be the next step, what may be the other opportunities. Who am I going to meet? What am I going to get to learn? I think those are always some special ones. So, Paule, thank you again for joining us on the Chili Purple Line podcast. What a pleasure to learn about your journey, your leadership, your mentorship, and the power of following your passion and helping others. Thank you so much again. Very much appreciate it.
Thank you for having me. This has been a gift. Thank you.
Thanks for listening to The Purple Line. Follow us on social media at The Chili, at THECHLI. Thank you for joining us on The Purple Line.